welcome everyone to the lower back pain workshop. That's very good, you got that, okay? All right, so welcome to the free neck pain and headache workshop. We're going to talk about headaches, we're going to talk about pinched nerves, we're going to talk about all kinds of different neck pain, okay? So there's different types and different causes for neck pain, so we're going to chat all about those. In a minute here, I'm going to preview my history for you, just like professionally and personally. But to start it off, just to make sure everybody is in the correct room, and you're not looking for the back pain workshop, which I have taught here before, but right now it's not what I'll be speaking about. Oh, by the way, before I forget, how many people just came for the free book? You can raise your hand and say aye. Unfortunately, you actually won't be, well, you'll kind of be getting a free book. That's sort of a two-edged sword there, okay? So, so I'm almost in editing, okay? The free itty-bitty book about lower back pain, so I was offering a, sort of this is like the launch of my new book, okay? I wrote a book on back pain called Itty-Bitty Book About Lower Back Pain. I do have copies here, so even though you're not here for the back pain workshop, if you do have back pain or you know somebody with back pain, okay, they're on the back there. There's like 3 copies, so you all have to run for it and see who can make it there first, okay? No, for real though, at the end, you can definitely have you know, your hand at that, and if you need a copy, that's perfectly fine, okay? And then what I'll do is via the sign-up sheet, once my book is published, I had our little miracle there, Cameron, she's 5.5 months old, okay, and that's my wife Heather in the back. I thought I was going to get things done really quickly, thank you, but I realized it like completely changed my life, for the better, but let's just say I couldn't be as focused as I thought I was going to be. I tried like writing while she was like screaming in the background, and then like I realized that like it just wasn't working very well. Okay, so the timeline got pushed a little bit, so the book is not fully published, but it will be there very soon. And what I'll do is I'll mail each and every one of you a copy once I'm finished with that. All right, so you can expect that sometime randomly in the mail. I don't know, in the next few months. Okay, so if you get a little package in your door and it says from Dr. Charlie, that's probably what it is. Okay. Cool. So just to make sure everybody's in the right place. How many people in the past 30 days have had neck pain, arm pain, numbness or tingling, headaches? Raise your hand and say aye. Cool. So we're all in the correct place. Great to have everyone here. Probably the best way to do this, and I do this with most of my other workshops just because it creates a sense of community. You don't have to, all right? Because I don't want to put you on the spot. But in a moment here, what I'm going to ask everyone to do, if you're willing, is just go around and share a little bit about sort of what brings you here. So your story, if you will. Now, luckily, I don't have time probably for everybody. So some of you will get out of this, all right? It just depends where I decide to start. Usually I start like, you know, in the front. You say Justin?
Jason.
Jason, okay. Usually I start in the front, but maybe I'll spare you and I'll start someplace. I'll popcorn maybe, okay? Start in the back, Karen. Start in the back, okay. Cool, so, yeah, so let's do that actually if we can, okay? And then what I'm going to do is I'm going to share a little bit about how and why I became a PT, so a little bit about my background, so you know a little bit about that, and then we'll kind of move into it, all right? So, let's see. You're okay starting?
Sure.
Okay, go ahead.
I saw the advertisement here at the library. And
Awesome.
I wanted to learn about it.
Cool, okay. Now, okay, correct me if I'm wrong. I got so much going on in my life. It's Justin.
Jason.
Jason. I'm usually very good at this. I promise. Jason, okay? Yeah, we should have name tags or something like that. There's Marvel. I don't know. Okay. So Jason, okay? Do you currently have neck pain? Have you had neck pain in the past? Tell me about sort of what made you interested in this. And it's okay if you were just interested and you want to meet me. That's great.
No,
I like that.
I know other people that want to neck pain and stuff.
Okay.
So I just wanted to learn more about it.
Awesome. Cool. Okay. That's good. So how many people would like to be like Jason? That's great. All right, good. So awesome. Now let's go Vic, right?
Yeah.
Vic, tell me what concerns you, what brings you in.
Sure. So I have just a case. It's pretty mild, probably in the scheme of things, but kind of neck pain around here, and it's more shoulder.
Okay.
But what you described, like there's a lot of things on back pain, but I
Sure.
thought this was kind of more targeted to some of the symptoms I get.
Awesome. Okay, and how long have you been dealing with that, Vic?
Probably several years. It's mild.
Okay.
I mean, it's really not extreme, but it's there, and I notice it when I work out.
Okay.
Things, yeah.
So it's kind of like this annoying thing.
Right.
It's become like a nuisance, where it's just like some type of like long-term disability here.
Right.
Okay, but
Yeah.
still, it's important. It's meaningful to you. So
Yeah.
you're still working out. Specifically, like what types of things make it worse?
Well, I mean, certain like shoulder, arm raises, certain
Okay.
exercises, shoulder presses,
Yep.
those kinds of things. And,
Awesome.
yeah.
Okay.
Yeah.
Good. Is it Mark? Mark, do you have neck pain? Are you accompanying Dawn? Okay, Mark does,
You
okay.
have one in it.
Mark, what brings you in? If you don't mind sharing a little bit about your story, that'd be great.
I've got,
Thanks, Vic, by the way.
I'm pretty loaded up with arthritis over here on this side. I've got degenerative disc disease
Okay.
down there, in C5 and 6.
Okay,
Yes, it's all, last MRI I had in there, to me, it looks like a bag of Oreo stuff's in there, quite frankly. It looks pretty, it's pretty
okay,
banged up.
that doesn't sound good.
Yeah.
Except for the Oreo part, right?
Yeah, yeah, right, that part.
That's
Right.
bad.
Except for when they're all crunched up.
Yeah, it's true, it's hard to eat, I get it.
Yeah, it limits my range of motion.
Okay.
Pretty good.
All right.
If I try to turn my head to my right
Yep.
for any length of time, it hurts. Looking up, looking down if I'm trying to look down for any length of time,
Yep.
forget about it. It hurts like crazy.
All right,
Coming
so-
up out of there.
I'll have to keep an eye as you try to go through the quiz here.
Yeah, you'll see
Sorry,
me, you'll
yeah,
see me do
okay.
this.
All right, and I might see others, and that's the other thing. So I'm pretty informal, okay, if you haven't recognized yet. So if you need to get up, move around, I don't know, shake your head out, whatever makes the bag of Oreos feel better, then we're good, okay? Hey, thanks, Jason, appreciate it. Okay, so what do you do for a living, Mark?
I sit at the computer all day.
Fair. Okay, how many people sit at a computer or used to sit at a computer if currently you're not doing that? Got it. Okay, so yeah, so part of the things I sort of do on the side, you could say, is I basically act as a workplace physical therapist. So I educate companies, workplaces, and employees, the people at the at these places, how to remain healthy while they're at work. And specifically, a lot of these people that have these issues, as we'll chat about, are people who sit at a computer all day, okay? Okay, awesome, so we'll chat about that, all right? And as you just kind of listen to the story, so I pick up on certain things, his motion is limited, okay? So he's already telling you he has a stiff neck, all right? Seems pretty simple, but we'll chat about that, okay? John, you're just looking like you want to share something. Go ahead, John, what's going on?
I have a diagnosis of cervical stenosis.
Okay,
I
got it.
practiced dentistry for 40 years.
Awesome,
So I
okay.
was in the same position all day long for 8
Yep.
hours a day.
Okay,
So I just have recurring pain on my right side
Okay.
when I wake up in the morning.
Yep.
Sometimes it just comes from nowhere.
yep, got it, okay.
Mhm.
So practice dentistry, yeah, was always kind of looking down.
Yes. Mhm.
Got it. Sort of like computer work, in a sense, just a little bit different, right?
Right.
And are you right or left-handed?
I'm right-handed.
Okay, got it. All right, so you're always sort of favoring one side as far as looking one way, using, right hand as far as to do your work, right?
Right.
Okay, it's been there for a long time.
Yeah. I practiced for 40 years, bothered me by the last 20, I think. Yeah.
Okay, got it. Any pain, numbness, tingling down the arm?
Not really.
Great, all right. And at this point, morning?
Maybe a little bit my gait when I walk, I think it's affected that a little bit.
Okay.
Mhm.
Yeah, so we'll chat if we get to it. That's an interesting point. I don't usually bring that up, but there are some conditions actually within the neck that can actually affect your balance and things like that, okay? When we get to it, maybe shout out and remind me to chat about that because it might be meaningful to you, okay? So again, sort of a trend, looking down, staying in one position, these static prolonged postures for not just like a day or an hour, like we're talking like months, years, decades, and so on and so forth, okay? And it starts to creep up on us. Very good, we'll chat about that, okay? And then why does somebody just give me like, we'll go one or two more people. This one? Your name again?
Larry.
Larry, go ahead, what brings you here?
Automobile accidents, broke 3 neck bones,
Okay.
3 months in a very firm cast,
Okay.
so they healed.
Yep.
But once I took the cast off, I'm not able to move my neck. I can't even drink a beer.
That's sad.
Oh my God!
You thought Vic was bad, he can't drink
And he
beer.
can't get the neck,
Too many
if
big
they
chocolate
aren't
water,
getting
what do you
after 2 months of physical therapy,
Yeah.
he's not getting the neck back.
Got it. Okay, so that's another good question. So how many people have been to physical therapy before? Got it. Okay, for other things, okay?
Chiropractic.
Okay, chiropractic, how many people have been to a chiropractor? How many people have been to an acupuncturist? Okay, Marcius, you've done it all, man.
I've tried.
You've tried a lot of things. All right, man, we'll have to work through it. Awesome. Okay, so last one. Anybody super excited? You in the back.
I'll be the last one because I'm probably the most complicated.
Okay, your name?
Rodney.
All right, I won't forget that.
My
Rodney, go ahead.
32 years as a tile setter,
Okay.
always looking down, right?
Yep.
Never a pain in my neck.
All right.
Then I retired and was snatched up as a cemetery manager doing a lot of computer work.
Okay.
Now I have a lot of neck pain.
All right. So did pretty well being in that active job, right?
Right.
So and
Pretty well, my neck was fine.
Yep.
I didn't have any problem with my neck, even though I had a car, my head went through a windshield when I was 14. I was hit
But you
by
were
a
fine
car.
after that.
I was fine after that. I was resilient
It was
and
the computer that
14.
got you.
Yeah, maybe it's the computer, I'm not sure what it is.
Got
There
it.
was no, yeah.
All right, well, listen to that. So there's something that you can pick up. So even though Rodney thinks he's the most complex, it kind of makes sense. It doesn't shock me. So
Really?
get this, right? So everybody in here who has these neck problems, maybe not everybody, but you'll start to see a trend that a lot of these people are sort of reporting like very static positions, right, that have brought on these neck problems. People who are usually say mobile, yes, you're looking down, but you're measuring this tile, you're going to the tile saw, you're changing positions and you're loading joints, discs, muscles, tissues differently. What we know about a lot of these problems is that a lot of these are what we call nutrient pathway disorders, meaning they're a blood supply problem. Okay, so just like a car burns gas to get from point A to point B, the body does the same. It's a combo of various sugars and oxygen. Okay. Now the issue is that so the body has to burn this fuel. Your ability to do work is in direct proportion to that fuel, okay, or blood supply that's delivering that, right? So now the body or the car burns exhaust, right? This exhaust is this toxic waste product of using this fuel. All right. What we see is that it goes out the back end of the car. In the body, it also goes out either the back end or the front end as urine, okay? So basically you get this toxic buildup of using these sugars within your body, and what you see is that this buildup creates this waste product. If you don't have a good blood supply to those tissues, also like you're sitting in a static position where you're constantly loading or wringing out those tissues, okay, then you can't remove those waste products. The result of that is that you get this uric acid or this waste product buildup within the tissue. Essentially you have pissy tissue, all right? You have urine within the tissues, all right? And that creates like this toxic, think of like a swamp. I was gonna say swamp because I was watching the Swamp Wars like thing on, I don't watch TV much, but like, I don't know, was it Discovery Channel or something?
Yeah.
And some guy wanted to start his own swamp tour business, and he wrote SWOMP. I thought that was kind of funny. So now when I think of swamp, I think of that. Anyway, so think of like this inflammatory soup, okay? This swamp where you can, now I can say it like swamp, where you have this buildup of this sort of toxic waste product, right? Where it's sort of a breeding ground for inflammation. When you're statically loading specific tissues over and over again, you just can't get the blood supply going back and forth enough to exhaust or get rid of the waste products, okay? So it makes sense that you, being very active and mobile and constantly moving your neck position, might actually feel pretty well, because it's like, okay, as I'm loading these joints and I'm working on this tile over here, okay, I'm starting to get annoyed, I'm building up waste products, have to remove them, and then as soon as sort of that threshold of pain turns on, you're then over here. And you sort of balance that load out versus John, who's sitting in one place, or Mark, who's at a computer, or maybe even Vic, is just statically like, sitting in that position for longer than they're not throughout the day. Okay, so that might make
Or
sense.
he had it in a cast for 2 months.
Yeah, that's no fun. Those casts are tough. So movement is medicine. So we see a lot of times after these injuries, especially after you've broken bones, okay? Traditional bone healing, like tissue healing times for bone in this case, is if you have really healthy bone, and unfortunately, sorry, you're wiser than I am, but in younger folks, okay, we see that it takes about 6 to 8 weeks or so for this bone healing. In older folks, wiser folks, okay, as long as you call yourself that, that's good. We see about 12 weeks. So the point is that we want these bones to heal, so we cast people, but then it's like then they lose their mobility. So there's a balance between that, and as we'll talk about sort of how arthritis develops, we'll learn that actually bone responds to and heals actually more appropriately with movement and with loading. So if you fracture your leg, maybe not acutely or immediately, but eventually you do want to get back on it so you can start to remodel the tissue. You need to stress out the tissue, and the bone will respond and grow in direct proportion to that stress that you place upon it. Now you're just left with a neck that doesn't move. I get it. Not good. I won't ask you to like say yes or say no or anything like that. Okay. Awesome. Where was I? So I don't remember where I was. That's okay. Thanks for the stories. So we're gonna kind of like touch on these different points as we go. Okay. So as I said, my name is Dr. Charlie Johnson. I have my doctorate in physical therapy. I also have my board specialty in orthopedics. As you'll learn a little bit, I work with spine surgeons at USC and UCLA on the West Coast, and that's where I got a lot of this experience. And this is what allows me to talk about this stuff in front of you all. Let's see, I own a physical therapy private practice in Royersford, Pennsylvania, not too far away, where I treat people exclusively one-on-one. John was in a little bit of healthcare, sort of, right? Different maybe sector, but I mean nowadays it's like you go to the physician or you go to a PT and you kind of, there's like 30 other people there while you're there. You know, you wait half an hour and then you spend 10 minutes with them and you pay them X amount. It's just kind of crazy if you ask me, okay? So I've seen the volume has to go up because we're getting paid less, and therefore I've seen, at least on my perspective, the quality goes down. And unfortunately, the only people affected are you all. We get affected because we got to stay late and do notes and crazy stuff like that. But at the end of the day, it impacts you who have pain and problems and legitimate concerns that need to be listened to. So I treat people exclusively one-on-one. My evaluations are 90 minutes. My treatment sessions are 60 minutes thereafter. And we try to get to the root cause of whatever we need to as quickly as possible. All right. So that's in Royersford. And real quick, before we get into the worksheet, because that's what's most important here, is a little bit about how and why I became a PT. So the traditional story of how people become whatever they become is usually they have an experience, usually positive, with it when they're younger, right? So the PT, you know, the story goes, hey, Charlie, growing up, like I went to PT, I had a great experience, I got injured, PT did everything they could, they got me back to X, Y, and Z, and it was awesome. I wanted to be a PT just like that person was for me. Great, so they go on, they go to school or whatever, and they're a PT. That's sort of like the fairy tale story, right? So mine's completely different. I think, have one experience with PT. I never went to PT, but I think I shadowed at one point. We'll get to why, but I actually think it was like a bad experience. I went in, it was like everybody was sitting on heat packs and reading magazines and kicking their legs out, and then I thought, wow, I'm going to go to school for a really long time to call myself Dr. So-and-so to give somebody a heat pack. That doesn't sound like it makes sense to me. So I carved my own path, all right? So anyway, growing up, again, not the traditional story. I came from a broken family, had a lot of help along the way, okay? But basically I had to be resourceful. So I had to figure out how to get to where I wanted to go. I was always athletic, played ice hockey, dissected like frogs in high school. I went to Perkins Valley High School, and I just thought it was cool how the whole thing was connected. At some point it came time to apply for colleges, and I thought, hey, well, I'll become a personal trainer. The problem is that as a personal trainer, I couldn't get out of the house, number one. I wanted to get out of the house, okay? And then number two, I thought, hey, maybe I can do a little bit more. Nothing against it, I just wanted to do more. So I said, hey, athletic training, what about that? I said, well, provided the family I grew up in, I want to be super close to my wife and my daughter. If I'm traveling, my dream was like I wanted to be on the bench for the Philadelphia Flyers, because I was a goalie, played ice hockey. I know I'm short, but I swear I'm fast. Okay, you can throw things at me and see what happens. Anyway, the point is that I wanted to do that, and I thought, well, I'm never going to be home, so what's next? And for some reason, I picked physical therapy, all right, even though I didn't have a great experience with it. And I applied to PT schools, got into my first one, woohoo, ready to go get out of here, and then I realized that I needed a lot of money to get into it, right? So basically what happened, long story short, through my high school career, I got really close to my high school guidance counselor. Her name's Carla Zielinski. She knows I say her name here. It's perfectly fine. And without asking her, did nothing really. She came forward and co-signed my loan to get me into physical therapy school. So pretty cool. That's my story. That's why I'm motivated to give back, just like she gave back to me. Okay? So, all right, let's do this. So everyone has that worksheet, right? Hopefully it's not killing you already. You've been looking up, now you can look down, we'll have you look up, we'll have you look down. Hang in there, Mark. Alright, so we're going to review some basic anatomy. You don't need to know everything, just get the gist, alright? The goal is at the end of this, you walk away with something such you have better tools, knowledge, and understanding about what could be going on, alright? I think the big problem with healthcare nowadays is that we don't really empower people, we disempower people because we give them passive treatments. People say, well, what makes you different from a chiropractor, from a yoga therapist, from a massage therapist? All those are just different modalities. It's like, do you want a hammer? Do you want a wrench? Do you want... Okay, none of those actually teach you about how to manage your own problem. So you go home saying, okay, I'm home, but I left the wrench at whatever the chiropractor's office was. Right? So you don't know what to do when you have a pain or problem to manage. All problems, Can we cure 100% of these issues? No, otherwise back pain would be the leading cause of disability in the whole world. This stuff is complicated, and unlike a car, it's not that easily fixed sometimes. But if we can give you the tools and the power to sort of manage these things, then that's our goal. All right? Awesome. So getting to know your neck. How many people know their neck in here? I don't even know what that means. All right, let's move on. Okay, so there are blank bones in the neck and blank nerves. How many bones are there in your neck? So picture the stack of bones, right? So I'm right-handed. I'm going to come here. I'll try to move if I have to. So here's your head. Real, like, complicated drawings to make, okay? How many bones? Do I keep going?
4, 6.
Do I keep going? Okay, there are 7 bones in the neck, all right? So basically this would be what we call C0, okay? C is just cervical, and 0 is like, it's just basically ground zero. This is the base of your skull, okay? And then you have 1, 2, 3, 4, 5, 6, 7 in the bones. These are all cervical, so you heard Mark say, hey, between C5, C6, that's actually the most common level for arthritis. We'll chat about why. That's where I have my problem. The 6th nerve is the most common nerve to be pinched. So preface all these numbers with C just for cervical or neck bone, okay? And they correlate to the level, obviously. And then you have T, which is your thoracic spine or your mid-back where all your ribs start connecting. Now this person, this is not a giraffe, this is a human, all right? This person has a very extended neck. She laughs at all my jokes. That's great.
It's good.
Good stuff.
Great.
Yeah, it's great, I love it. Okay, so there are 7 bones in the neck, all right? Now there are 8 nerves, all right? So I'll just fill that in for you, okay? So, and they're all, again, cervical. So this would be C8, C7, C6, and so on and so forth, all right? So these nerves travel from the neck through the shoulder into the hand. I'm going to make this person really out of proportion here. There's their arm, okay? So there's a major plexus of nerves. The fancy term is called the brachial plexus. There's a major plexus of nerves that comes from the neck, and it basically starts at the 5th nerve, okay? C5, C6, C7, C8, and then one of the thoracic nerves. Don't worry about all the levels, just understand that many of these nerves combine to go all the way down the arm, through the shoulder, okay? Actually can cause pain like underneath the collarbone, kind of deep in the chest. People think they strained their pec or something like that, and they get this achiness like through this area, okay? Goes all the way down into the hand, such that you can feel things like pain, numbness, and tingling in different fingers based on the specific nerve, all right? So, again, the most common is C6. What we see is that, say you were to kind of pinch that off, consider this. Consider that, if we were to use an analogy, that nerves are like highways. So they have multiple lanes, okay? They carry information such as feeling and movement. So your ability to actually touch and perceive that touch, and then your ability to actually wiggle your fingers, things like that, all right? Well, what we see is if you pinch this off, right, and let's just say that you irritate some of the feeling nerves within that highway, right, you cause sort of a traffic jam. If you affect the 6th nerve in the neck, you will often get pain, numbness, and tingling all the way down the thumb, maybe the 1st finger. The 7th nerve, sort of the middle finger. And the 8th nerve, very rare, but you'll get it sort of in like the pinky finger. Almost like where you get when you hit your funny bone. All right, go ahead.
The chiropractor uses the word subluxation all the time.
Yep.
That is the confrontation of the, that's when 2 bones, when they hit the nerve and the nerve gets interrupted or...
Fair. Okay, so I'm really upfront with people, okay? So here it is. So I did a lot of research at USC, which is the #1 rated program in the whole entire world, okay? I consider it a fairly good program then, okay? And I worked with a lot of surgeons and looked at all the evidence on these things, okay? And what we found is that looking for an actual subluxation, whatever that was defined as, whatever you want to call it, we don't consider them to actually exist. Meaning like they would say, like, hey, like your hip's out or your neck's out or something like that. I say, where did it go? We actually see no movement when we're not realigning anything when we do any of these manipulations or you get adjustments or things like that. I guess a subluxation will be defined technically by like a chiropractor. If they're a straight chiropractor, like some form of dysfunction within the artery and or interference within the nervous system, okay? But a subluxation actually, what it sounds like something sort of out of place, doesn't actually happen in the sense as they make it sound as frequent as it does. Now, if you have a fracture or something and something's actually slipped, call it a subluxation, I just call it a fracture, okay? But actually having like bones out of alignment, we have no proof to say it actually exists, and then when we do something, we put them back in place. That's sort of scary to think about anyway, and it makes people sort of, it starts this fear avoidance cycle, and that people think that they're out of place every time and they have to go back to be put back in, okay? Which creates dependency. And again, I don't like that because it's a great business model, but it doesn't do much for the person, if you ask me long term, okay?
Thank you.
Yeah, so just understand briefly, there's 8 nerves, and they can actually give pain, numbness, tingling, different weird sensations all the way down the arm into the hand, okay? Got it. So there are 3 regions in the neck. Most problems occur at the base of the skull or the neck. So let's just say this is upper, C1, C2, C3, okay? This would be middle, and this would be lower. So this would be like where people say, hey, I have pain like right here, like that little hump that you see on some people, right? So that would be the lower spine, this would be middle spine, this would be upper spine. The most problematic is usually the upper and the lower, and we'll chat about why here as we get to some of the different causes, all right? So the first joint in the neck, this is kind of neat. The first joint in the neck lets you nod your head as in saying yes. The majority of the movement, about 60% of your ability to say yes, actually comes from this ball just sitting right on top of the T, sort of rotating, all right? The second joint in the neck, right in between here, between the first and the second joint, lets you rotate your head, as in saying no, okay? 50% of your ability to actually rotate your head comes from between the first and second joints in the neck. So, that being said, Larry?
Yes.
Okay. Larry, if he's saying, hey, I have trouble turning my head, or maybe John or Mark saying, hey, I have trouble turning my head, well, where is it coming from? The cool thing is through the research and looking at live MRIs, we can actually localize, hey, is this an upper neck problem that the person has stiffness in the upper 1, 2, or 3 joints in the neck, and that's what's limiting the rotation, because we know that 50% of your ability to turn actually comes from there. So let's make sure we check that out and see how it's moving. And if that's moving okay, then is it something elsewhere? So we can start to localize where these issues are by just sort of putting the puzzle pieces together, all right? And in your case, you had, what levels were broken in your neck, do you remember?
I think 1, 3, and 7.
Okay, so he had 1, 3, and 7. So 2 of his buddies in the upper neck were broken, all right? So I don't know exactly how they healed, but you could expect that he's going to have trouble there, right? And how much of it is going to be able to be restored? Well, if we can't get rotation there, we might have to go somewhere else, right? So there are some workarounds, but just given the fact that you're telling me that, I wouldn't expect that your ability to turn your head fully would be fully restored, because you've actually impacted an area where most of that comes from, all right? I don't know what that plateau or what that level would look like that you could get back to, but it's something to think about, all right? Cool. Awesome. Those joints are super important as we get to headaches. So real quick, professionally, how did I come to specialize in neck pain? Again, I got my doctorate from Lebanon Valley College, which is in central PA near Annville, near Hershey Park, not too far from that. And I got my board specialty in orthopedics from the University of Southern California. Basically what happened is I was that student, the annoying student in school who always wanted to know everything. So I was like the person in the back of the classroom who said, always had my hand up, everyone else was ready to run for the hills, go to lunch, do whatever, right? And I was like, wait, I have a question, wait, right? And they were like, man, put your hand down. But anyway, the point was in academia, I could get my questions answered. I could easily send an email, I could just stay late for class, something like that. When I got out into the real world, I realized it didn't happen like that. We were so busy pushing people through in medicine that like, I had questions about things because I was new, young, and hungry, right? And nobody could answer them. Or they answered in a fashion that I knew in my heart was like, there's got to be something better, right? So I wanted to either wanted to go look for that, right? So I either wanted to go big or go home. So I said, I'm going to quit. And my wife said, whoa, whoa, whoa. You have like a lot of student loans and like you're actually really good at what you do. Maybe it's just the environment. So I said, all right, well then I'm going to go big. So I said, I'm going to go to the best place in the whole world to try to figure this out. Apply to different, what we call residency programs. How many people know that you can go see a physical therapist who has specialties in different areas? Just like you would go see a specialty, maybe dentist or a physician or something like that. So within physical therapy, it's fairly new. my residency training basically puts sort of that expertise within the top 0.5% of all PTs. So it's very rare still, it's up and coming, but let's just say baby Cameron had a problem. Where would I bring her? Pediatrician, right? If we had a heart problem, you would probably go see the cardiologist. You had a tooth problem, you'd go see a dentist, right, or something like that. I had a person who was trying to schedule for 2:30, but I couldn't get it in. Okay, so point is that there's specialties, right, within medicine. Well, for physical therapists, you can do the same. So it's very rare, but basically at USC, I just learned about orthopedics. So I was there for a little bit more than a year in Southern California. We drove cross country, and I was mentored in the clinic, so I worked in the clinic. I did research on shoulder pain, neck pain, and back pain. I taught in the PT program for the whole year. I worked with the surgeons at USC, UCLA, did all kinds of unique things, and again, that's what I try to bring back here today. So pretty cool. In physical therapy, they're called basically board specialists. So it's got special initials at the end. I wish the public knew more about it, but maybe one day. All right. All right, and I offer, again, a different kind of PT. I only see people one-on-one. I feel like that's the best way to help people and listen to people. 7 must-ask questions report. Everybody has one, I think, except for Dawn. If not, you two are sharing, right? This report, right?
Yes.
I only give you one, I think.
Yeah.
Okay. This report, I have a YouTube channel with a bunch of followers, and I get emails all the time. Dr. Charlie, my neck hurts, my back hurts. I'm in India. Can you help me? And I said, oh, that's going to be kind of hard. Not only are there like telehealth like laws as far as like information and things like that limit me, but they're kind of far, and it's kind of hard to tell without seeing them what to exactly to recommend. So the point is that I said, well, go see a good PT. And they're like, well, what do you mean? What does that look like? So I said, well, I should probably create a report, okay? So I created a report after traveling across the country and having these people on my YouTube channel, meeting with different people, that sort of explains what to look for in either a good physical therapist, or you could even use it for a chiropractor, something like that, okay? But it has sort of a summary there and some of the questions you should be asking. Itty bitty book about neck and arm pain. As I said, I don't have that tonight. I will send it to you all. I do have copies of my back pain book, if you'd like that. All right, so first things first. Anybody you go to see, when you have, in this case, neck pain, arm pain, hand pain, numbness, tingling, the first thing we want to know is your neck pain, arm pain, or tingling reproducible? So that's the fill in there. Okay. It's the first step in the questioning. Okay, so you've got it, and we have to start to narrow it down. So what I mean by is your pain, numbness, or tingling reproducible is I want to know what makes it worse. So, Mark, he said, turning my head. I think John.
It's pain. That's not
Pain, okay? Anything specific that makes it
more
worse?
feels like more muscle than it does, right at the base of the skull here.
Okay, got it. Is there anything you can do movement-wise, mechanically, that will make it worse?
No, I don't believe so.
Okay, got it, just kind of there.
Yeah,
right?
yeah.
Okay, all right, what else? What else makes your neck pain worse? Or hand tingling, Blair, or whatever?
Sometimes just writing.
Okay, writing. We already said writing. I specialize in writing, as you can tell. It used to be good, and then computer
Some of
work.
that could be also because I'm in this position.
Okay,
My
so
head
great.
down
Looking down,
and
yeah.
writing or sewing, that
Sewing.
grips my hand all the time.
How about sleeping?
Sleeping on your side.
Yep. What
Well,
else?
anyway, how about sleeping?
Sleeping.
Okay,
I
Tyler?
wake up in the morning and that's the worst time, is waking up and having to hold my head
All right.
to get out of bed.
Okay, cool. So now we're starting to talk about a slightly different thing, but 24-hour cycle. So how does it feel morning, afternoon, night? Certain things,
That's
arthritis, for example, usually is something where people say the opposite. Let me explain. People with arthritis say, hey, Charlie, when I'm sitting down and then I go to move, it's like super stiff. All right, or when I wake up first thing, it's super stiff. But the more I move, the better it feels. All right, so movement for them is their medicine and actually feels better. All right, so they loosen up as they go along. Somebody with like a real acute problem, maybe a disc herniation or something like that, says every time I move, ooh, it gets worse, and maybe the more they move, the worse it gets, right? Versus arthritic conditions traditionally feel better with movement, all right, versus the opposite. So the point is, we could go on and on here. about things that reproduce your pain. The point is that in your brain you probably have something, and we could dig deeper at some point, John, but we probably have something that clearly says like, oh yeah, that's the thing that brings it on. For you, it started like as a mechanical thing because you're always looking down, right? All I'm trying to get through asking these questions is what type of pain do you have, all right? So when somebody treats you for anything in this world, all right, there's 2 decks of cards. As a PT, I want to know, I'm a physical therapist, so I am sort of a mechanic, if you will, of the body. I wish it was that easy, but it's not, okay? Point is I want to know, is this a mechanical problem? A mechanical problem requires a mechanical solution. You get that? If your brakes are rusty, or a door hinge is rusty, okay, I can wiggle it, mechanically move this thing, and maybe put a little WD-40 or something like that, and it'll feel better, right? So mechanical problem requires a mechanical solution. A mechanical problem is usually one which says, oh, every time I do this, oh, there it is. Every time I try to do this, there it is. Every time I sleep in this position, there it is. And if I avoid it, it's not too bad, all right? So it's sort of that light switch phenomenon that's on and off, all right? The other type of pain is a chemical pain. Chemical pain is like what anti-inflammatories usually work pretty well on. If you take anti-inflammatories for a mechanical problem, they're not going to help. You're going to say they don't help all that much, okay? If you take anti-inflammatories for a chemical problem, one which constant pain keeps me up at night. I can't do anything because it hurts all the time. That type of pain, right, that gets worse and worse with movement and doesn't just go back to baseline or nothing whenever you stop it, okay? Those types of things traditionally are more chemical. There's some type of inflammatory process they respond better to, usually some type of medication, all right? And within that mechanical stack of cards, you also have an other deck of cards. The other deck of cards is bigger and uglier things that can cause neck pain, all right? So we're talking about some type of tumors, whether it be brain, whether it be at the base of the spine, whether it be in the neck, whether it be some type of infection, meningitis if you're younger, you know, different things like this, okay, that obviously as a physical therapist, I can't deal with. So we ask these questions because in a very rare occasion, we're talking about 1 to 3% of the population, will somebody come in with neck pain and it is that thing, that big and ugly thing, okay? So we have to ask it, you know, if somebody says everything hurts, it doesn't matter what I do, I can't sleep at night, oh, and I have a history of cancer, I'm losing weight, and yada, yada, yada. All right, it's starting to smell a little fishy. We can identify that and then pass it on. So that's what makes this a really good entry point to the medical system, is we have just enough medical knowledge to pick up on those things and screen for those things, all right? So reproducible, that's the on switch, right? So if there's an on switch and you have pain, numbness, or tingling that's reproducible, the issue is often reducible. Right, so if you can figure out what turns it on, almost always there's something that turns it off. And we're going to chat about what treatment looks like to try to figure those things out. Really, the first step is really good questioning. So really good what we call subjective on part of like the physician or PT or whoever you go to. You have to have somebody who's going to sit down and chat with you. If they sit down for 5 minutes, they're going to give you the first thing that pops in their head that, you know, is like just like a rote response or like a cookie cutter response. Like, oh, you have this and this and it hurts here. Okay, you've got this, and then that's when you don't get better because they don't listen to anything you're saying, all right? So the point is you have to have somebody listen to what's going on because think about this. You go, how many people have had injections in their neck? All right, injections, got it. So you go, okay, it hurts here, you take an image, you got arthritis, we're going to do an injection here. Well, the issue is that's sort of like altering or like band-aiding the pain because you're treating the source of the pain, where you feel the pain. You're not getting to the root cause. So I can't tell you how many people have come to me and say, Charlie, my neck hurts really bad or my back hurts really bad, let's just say, and the one thing that was killing me is I was sitting at my computer all day. That was like really aggravating my neck pain, my arm pain. So I went and I got an injection. You know, it felt good for like a week and a half, maybe 2 weeks, maybe even a little bit longer, but I can't figure out why I came back. Well, okay, so I say, well, what do you understand better now, like after the injection, about what you've got going on than you did before? Well, nothing. They just stuck a needle in me and got in. Okay, you didn't learn anything, so you have no power in controlling the situation because you don't even know what the problem was to begin with. So you put water on the fire and it keeps coming back because you go sit at your computer the same way you're always sitting at your computer. Well, that's like the emoji thing where you like face palm it or whatever you do, you know, like to the forehead. Well, of course it's going to come back. It doesn't make any sense you can continue to do whatever you're doing that's aggravating it, get an injection, and then just go back to that stuff. It's not logical, if you ask me, okay? That's not any fault on your part, that's just fault of people probably not listening to you and taking the time to explain what's really going on, right? Because we don't have the time a lot of times. Awesome. Where are we at? So I have their trouble tree. It's based this idea that when you talk to people, right, a lot of people say, hey, I have pain when I'm at the computer working, things like that. And you say, okay, everything hurts about working at the computer. No, I mean, there's something specific about what you're doing at the computer that's bringing on symptoms. It might just be that, I don't know, your document holder is always on the right side, so you're always looking over there. Or you're always using, I don't know, you're using a double screen or something like that, and the one shifted over further to the right. Or you don't have a headset, or you don't support your arms throughout the day. Therefore, your arms, your neck muscles connect to your arms. So if you're constantly down here kind of reaching for the keyboard, you're essentially compressing the spine. So can you sit in a corner seat and kind of support those things? There's all kinds of different tips and tricks, but you really have to kind of weasel your way through this idea of this trouble tree. Hey, my neck hurts when I do computer work. Oh no, but it only hurts when I do that. And then no, it's not when I do that. So then you end up with people saying, oh yeah, you're right. It's only when I'm at that seat or when I'm at that computer that I really get my symptoms. So you really have to narrow it down, all right? Now, the single biggest mistake people with neck pain make is what do you think they do? They ignore it. Just like anything else, right? They think it'll go away. And then before you know it, it's like there for like 20 years. Or they try something and they were failed by the medical system and or put into chronic pain because they were told that they have the stiffest shoulders ever, or they have like the most subluxation somebody's ever seen, and of course they get down on themselves. So yeah, the chiropractor told me I was like out of whack. I feel great. You know, it starts the whole cycle, okay? Same thing with a PT, you know, like, oh, he told me I was weak as can be, or something, you know, I don't know, whatever, okay? So yeah, they ignore it. So this would be like, hey, I'm just getting old. My mom had it. There's some evidence for a link of genetics, but it's not really consistent in the evidence. The weather's bad, again, maybe some evidence there as far as the barometric pressure, but not well supported, so on and so forth, okay? What's the next way you can deal with the problem? You're not ready to, so you've ignored it long enough. You're ready to do something about it, but you're not quite ready to, you can fill in the blank. The bottom won't be handle it. You camouflage it, you alter it. This would be, in most cases, meds, injections, surgery. Now, these things aren't always altering it, meaning sometimes it needs to be altered. I had a lady the other day call me up, says, Charlie, I think it's too late. I've been trying to avoid you. So, why? I think I'm a pretty nice person. She said, well, because I didn't want you to like tell me to stop running. I was like, okay. Well, now, she said, I think it's too far gone. Okay, so go on, right? Basically, her left arm had been numb for like 2-3 months completely, where she couldn't feel anything. So I'm like, well, that doesn't make any sense. Now you're never gonna be able to run. No, I didn't tell her that, but she just made it to the point where it was like so acute and so irritated and so annoyed that then coming to see me with my firepower, I'm sitting there with like my little water pistol trying to calm this thing down. You might need something more potent like a local injection, and or in her case, maybe if we can't calm it down with that, some type of, probably not, some type of surgery, but if it's kind of affecting the health of the nerve. But the point is that sometimes if things are really irritated, there's a wildfire burning and things are really acute and very sensitive, everything hurts, you sometimes need medications to calm that down. So not completely against them, I just think that they're overused and the model's a little flipped, all right? Or you can handle it. So this would be like, go see a good PT, go see a good chiro, or more like the different, go see a good whoever, okay? Somebody's gonna listen to you, right? All right, the 4 common types of neck problems. So this is kind of what Mark was describing. So the first one, stiff and painful. Stiff and painful. This is things like spinal stenosis, okay, cervical stenosis. What is stenosis? Yeah, narrowing. Yeah, narrowing basically. You have spaces within the spine, and stenosis will be narrowing of those spaces. Okay. You have, how many people know Arthur? Arthritis. Yeah, you know Arthur, right? He's like, you wake up and he's right there every day. Except you can't see him. All right, so yeah, so arthritis and then DDD. So, sorry, the fill in there is Arthur, or arthritis. And then DDD, what is DDD? Like degenerative disc disease. So, there are a lot of causes of neck pain, a lot of diagnoses. As a physical therapist, and we'll chat about this at the end, those diagnoses don't mean all that much to me because they don't change the treatment in the majority of cases, all right? And we'll chat about this because the important thing, and one of the things I want you to walk away with, is that x-rays and MRIs lie. Meaning, the truth is that 80% of people over the age of 50 will have a herniated disc or something nasty. Of course, you're over the age of 50. Something on their MRI, x-ray, that's going to say, oh, you've got, in this case, a herniated disc. So, at the very bottom there, a blank percentage of people over the age of 50 who have a bulging disc and feel no pain. People feel no pain. There's no correlation between spinal stenosis imaging findings in the neck or lower back and pain. But that's what people are told. They're given a trump card when they go because they want to know so badly. Okay, you have stenosis. And then you walk around with it like this for the rest of your life. Everywhere you go, I have spinal stenosis. Okay, that might be part of the problem, but you have to correlate it. And the majority of times, okay, it just doesn't correlate. And we've seen that in the evidence, all right? So that's why focusing on a lot of these diagnoses are not super important and not helpful in the management of these things. And we've proven that. Because now back pain is like a raging epidemic. Yet we try to diagnose everybody with all these different things, and it doesn't lead to any better treatment, right? The problem is that you're taking a microscope to the spine. Just like you have wrinkles, wrinkles don't cause you pain. Just like you lose your hair, you don't have a headache all the time, all right? You have wrinkles in your bones, arthritis, and all of a sudden, all heck breaks loose, all right? And people convince you that you're disabled and that arthritis, it's going downhill, right? So, point is, stiff and painful neck. Yeah, a lot of these things will be considered, bless you, spinal stenosis, degenerative disc disease, these things obviously do exist. They just don't often correlate, and you have to make sure they correlate before you go ahead and get a treatment for it, right? So, all I want to know is I want to put you in a specific bucket, if possible. That is the best evidence-based, most proven treatment for neck pain. When you come to see me, okay, you've got all these things. I get it. That kind of makes sense based off what you're telling me. But what you're really telling me is you have a stiff and painful neck. Let's just keep it simple, because making it complicated doesn't make it any better, all right? Now you have a stiff and painful neck. So these people are generally, how many people have more than 50 candles on their next birthday cake? All right, got it. So, great. It's like really slow at the end here. So greater than 50, okay? They say, my neck feels stiff. I can't turn my neck, all right? Feels like I have a crick in my neck, something like that, all right? Larry, you definitely have a stiff neck. Mark, sounds like you have a stiff neck too, okay? And it hurts, right?
Still 150 though.
Yep. Oh, cool. Got it. Very good. So now, here's the reason a lot of this stuff, this proposed arthritis, right, develops. Let's look at the mechanism and the source. And again, the source might be arthritis. Hey, I feel the pain right here. But why did it get there? That's what I want to know, the root cause, right? So, because we don't treat that, it's sort of like this. It's like if you're cooking marshmallows outside and you got a fire pit, right? You go outside, it's the end of the night, you're like, oh, it's getting a little windy outside, we're going to go to bed. Honey, go pour the water on the fire. Okay, okay, it's out. And then you look outside 5 minutes later and the thing's burning again. You're like, what the heck's going on? Either you didn't put enough water on, that was the source, right? Or let's just say like the neighborhood kids are running around with fiery marshmallows, throwing them in the fire pit. Your fire's never going to go out until you choke the kids with the fiery marshmallows, all right? You get the concept. That's the root cause, all right? The source is where you're feeling the pain. The root cause might be how you're doing things every day. And you're getting temporary relief from people treating the source and shooting images at the source. That's where everybody's looking. But they're not looking at the contributing factors, and they're not educating on how you can control those things, okay? So you just have this wildfire that starts up again. These people usually have pain at the end range of motion. They can have pain mid-range, but they say, oh, there it is. Feels a little better. There it is, okay? It's sort of this reproducible on-off phenomenon, all right? Part of the reason this stuff develops is that if you look at the traditional computer posture, you're sitting something like this. Here's your nose, here's your eyeballs. Okay, you're looking at the screen, right? So what you see is that it's really difficult to annoy a spine or anything when it's in sort of a good neutral position, when it's stacked well on top of one another. The issue becomes is that we all do this, right? And some of us, if we're tiling, right, you might be doing it for a little bit, but you're constantly moving. Static posture is the real issue here, okay? Movement, there's two types of work that's done by the muscles, joints, bones, tendons. Movement, I did something, and now I didn't do it. I loaded something, and now I didn't do it. Rodney?
Yeah.
All right, so Rodney was doing stuff, and then he wasn't doing stuff. He was loading it and then coming off of it, right? Versus John or Mark, right? Static posture. Movement is like a sprint, all right? Use it, get off of it, all right? Posture is like a marathon. You're just loading things all day, okay? Blood supply issue to those tissues, all right? What we see is pictures like a paper clip. If you sort of keep like, if I exaggerate it, right? If you bend these paper clips over and over again, where are the weak points? Here and here, right? Here, here, and then a little bit at the base of the skull, right? So we see a lot of these problems here. We see a lot of problems at the base of the skull because there are these hinge points where if you were to zoom in at the bones, and these are out of proportion, obviously, okay? You can sort of see that you have kind of compression here and compression here. You get that? All right? So they become sort of compressive points within the spine. Now, get that when you have these compressive points, you're loading the joints within the neck. You're loading a lot of different structures. But when you have arthritis, understand, like I said to Larry earlier, bone will respond in direct proportion or grow in direct proportion to the amount of load that you place upon it. So when you fracture your leg, right, the goal is that, hey, I'll do more work. Okay, body's doing more work. Body's saying, hey, I need to send more bone cells down there to keep healing so that I can handle this stress, right? Well, these little joints in the neck are about the size of your thumbnail. They're on either side of the neck, okay? And what we see is that they're very small, and as they're getting friction moving together, the body says, I know what I need to do. I need to build more bone because I'm getting stressed out. Well, the problem is, in like a healing bone, that's a good idea. In a neck, where there's not much room, where the nerves exit and things like that, all right, what you get is friction, and then you start to lay down more bone because it says, hey, if I get more bone, I'll be able to disperse the forces on this little joint. Well, now you have a joint that now is double the size, and then you have a nerve that has half the size to or half the space to travel, right? So you start to build up bone or bone spurs within these joints to sort of accommodate for this extra stress. The problem is that it's not like a good thing at that point. It's sort of working against you, right? So that's sort of the proposed mechanism behind these like arthritic conditions. And what we get is the head like a bowling ball. It's about 12 to 14 pounds. When it's stacked right on top of you, perfect. Everybody's happy, just like a golf tee, okay? When you start to move it this way, if you hold a jug of milk and it's here, would you rather hold it here for 10 minutes or here for 10 minutes? Okay, same idea. So you got 12 to 14 pounds, now you move it out 5-6 inches, and now you've got, the weight of the head is about 3-fold now, all right? So now you've got 3 times the compression on the joints, the muscles have to work 3 times harder, and oh, by the way, now the neck muscles are stretched out. So it's sort of like hanging on the edge of the cliff, like, I'm kind of stretched out, I don't really have much strength anymore to do what I need to do. So now your neck muscles are weakened because they're lengthened over this rounded upper spine, and the first thing you get is you get this like kind of pain at the base of the neck and or between the wing bones, okay? And then you start to get stiffness as it goes up. You also get compression at the base of the skull because you're sort of in this hinge position, all right? The upper 3 neck joints, as we'll talk about in a moment, refer right to the head and can cause one-sided, sometimes both-sided, usually one-sided headaches, right? And then you get stiffness here because you're kind of all jammed up. Okay? And then sometimes jaw problems because it changes the orientation of the jaw relative to the head. And you might know about that. Okay, TMD, TMJ, those sorts of things, right? Cool, all right, so now the next type is a weak and painful neck. Get that a weak and painful neck could be caused by stenosis, all kinds of different things as well. But since they don't always correlate to pain, it's not helpful to go down that rodeo. So what we do is we say, okay, you have a weak and painful neck. How do I know if your neck is weak and painful? Because you say, I don't have a stiff neck. It feels weak. You sit there and you look objectively at the way somebody moves their head, all right? And I just treated a lady the other day. I went to PT and they were doing all these neck stretches. I can't figure out why I wasn't getting any better. Because your head can't move any further. You don't need stretching. You don't have a stiff neck. What if she had a history of a motor vehicle accident, all right? What if you just needed some more strength or stability in your neck? She said, my neck feels heavy. It feels fatigued at the end of the day, all right? I've had a motor vehicle accident. We know that the neck joints, again, the upper neck joints, link directly to some of the visual fields. So there are certain things you can do. You see people who have had trauma, whiplash, things like that in the past. They'll actually lack coordination in their neck joints, right, as it relates to their eye movements. So you'll put a laser on their head, and you'll point it that way, and somebody who doesn't have that type of trauma in the past, no neck pain, you'll be able to say, okay, you see that? Practice it. Got it? Okay, just like I can do this and not really think about it. I'm not looking at it, I just know where my finger is intuitively, right? Your neck joints know the same. They know the position in space, right? So these people with no neck pain, perfect, every time, right on the bullseye. People with these motor vehicle accidents or these whiplash or these weaker necks, okay, they look at something, they close their eyes and they go like this. Oh wow, I'm way off. They have no clue where their joints are in space, all right? So there's some different retraining and some of the evidence we can do to help with that, all right? So yeah, these people say, hey, I've had motor vehicle accident perhaps, or when you look at them, they're definitely not stiff. So if they're not stiff and they don't have a pinched nerve and they don't have a headache, well, let's check to make sure they don't have weakness in the neck. And we have standards for that, and we have ways to measure that to determine if you've got that, okay? So consider that was written up there, all right? Okay, the final thing, or not the final thing, sorry, the third thing. Pinched nerve, this is number 3. Pinched nerve. So pinched nerves can be caused by a lot of things. Specifically, if you're going, the physician or orthopedic physician will say, hey, you have spinal stenosis, C5, C6, C6, C7, something like that is pinching on a nerve, is causing it to go down your arm, okay? And or herniated disc if you're a little bit younger, but really at any age, all right? What we see is at the most common level to get pinched, again, is the 6th nerve in the neck. People with a problem in the 6th nerve in the neck, like I said, will say, I have pain, numbness, tingling, it goes all the way down here, and or, oh, I have this elbow pain, tennis elbow, and I'm wearing this brace, and it actually makes it worse, and I got injections there, and it only helped temporarily, and, you know, occasionally I get some numbness, tingling into this finger, but they didn't ask about that, so they treated me for tennis elbow, and it just won't go away. I went to PT, I went to acupuncture, I went to chiropractic, I went everywhere. Move your neck, do this for me. Oh, my elbow pain's gone. Do this for me. Oh, it's worse. It was never a problem with the elbow. It's real simple. People come to me and they say, other people do the job for me. I went everywhere and they treated the elbow. The definition of insanity in healthcare and not in healthcare, I think, is like doing the same thing over and over again expecting a different result. Okay, so I went to one doc. No, they said it was an elbow. They're all treating the elbow and it's not getting better. So all these smart people are treating the elbow and it's not getting better. It's probably not the elbow. Look upstairs, because what we know is a lot of these nerves, that plexus, 5 of them, okay, they pass between a few muscles here that get stiff a lot of times when we sit like this, all right? And if you irritate a problem up here, it's just like a kink in the hose. You're going to have changes all along the path down here, okay? Carpal tunnel, oh, hey, these people get numbness, tingling in a very similar distribution of people who have problems up here. We have evidence to show that women with carpal tunnel have reduced neck range of motion. Coincidence? I don't know. Were they diagnosed with carpal tunnel and had unnecessary surgeries? Maybe, maybe not. Or was there actually a problem here and here? Sometimes that can be it. It's a little bit more complicated, all right? Just get that problems in the neck and problems even in the lower back can mimic and or cause problems way down the chain, all right? I have a guy in the tree right now with plantar fasciitis. Everyone else did all the work because they say, yeah, it's plantar fasciitis. I went to 3 podiatrists. I got injections. I spent $2,000 on orthotics. I did this, I did that, and it's not getting better. I said, do you ever have any back pain? Well, no, not really. It gets worse after he goes through his whole story. I say, stand up, bend backwards 10 times. 2 years of heel pain, gone. It was a problem in your spine the whole time, and everyone was looking at your foot. And they just told me it was not your foot because they went through and treated it like they should have over and over again, and they just were insane. Okay? So get that there are problems in the neck. A lot of these overuse syndromes in the elbows, in the hands, even rotator cuff problems can sometimes mimic as neck issues, can start in the spine. All right? Because it's just like a highway. You have a problem here, you could get kind of referral issues down the path. And there are certain clusters of tests we do for that. People with pinched nerves often have like pretty bad pain like in the shoulder blade area. Some of the joints can refer there as well, but often a first sign is like this base of the neck pain, shoulder blade pain, and then they start to get this kind of numbness, tingling, it travels down. Right? It can happen, but usually not the pinky fingers for pinched nerves. Sometimes it's just very rare. We're talking about 7 to 12% is what the latest evidence shows. Okay, but it can happen, and there are certain tests for that that are proven to point that out. All right, the final thing is headaches. Caused by upper neck stiffness and neck weakness. Both of them. What do? We gotta figure it out. There you are. You got no mouth. Sorry. Okay. So the upper 3 joints in the neck. The culprit in headaches, one-sided headaches, there's 5 types of headaches. The culprit in one-sided headaches that start at the base of the skull, wrap up like a ram's horn towards the eyeball, okay, is usually the 2nd and 3rd joint in the neck. It's just not moving well. You've got stiffness. There are different tests we can do to assess for that, but get this. So, has anybody ever had shingles in the face? All right, so that same sort of bundle of nerves, yep, at the base of the skull that's responsible for shingles. It's basically a problem with one of the nerves at the base of the spine, cranial nerve, basically. Okay, you have this this nucleus, fancy term. Try to say it with me. Ready? Trigeminocervical nucleus. Don't worry about it. Okay, it's a bundle of nerves at the base of the spine. Those nerves allow you to feel sensation to different areas of the face. Okay? Well, these joints have links in directly to that ball and bundle of nerves. So therefore, a problem down here can definitely cause, and is proven to cause, pain in the temple area. A problem at the base of the skull will cause eye pain. A problem as you go further down, 2nd and 3rd joint will start to cause pain back here, and then moving up towards the temple, back of the head. And then the other nerves down start to cause problems in the arm. All right? So, it's definitely can occur that you have a problem in the upper neck that's causing either headaches and or dizziness. We call them cervicogenic headaches, meaning cervico from the cervical spine, genic, I guess of origin or something like that, okay? And they're coming from the neck.
Where's the atlas?
Yep.
Is that actually a neck joint?
Yeah, so the atlas is the first neck bone. Atlas and axis, all right? So, the reason that, your name again? Amy, yeah. The reason that, so here's your base of your skull if you're going to zoom in. Atlas, C1. Axis, C2, okay? Axis has a pin on it, basically, all right? And atlas has a hole, okay? So the ability for you to rotate your head, 50% of it comes from this joint because it's that joint, it's meant to rotate like that. The other joints don't have that. They just have sort of joints that come together like this, all right? So you have sort of a pin joint up there. I don't really know what to call it, but atlas is just a fancy term for the first bone in the neck, atlas and axis, right? They call this the atlantoaxial joint, just the combo of it, okay? Awesome, and these people, yeah, again, they often have weakness in the upper neck muscles. Now, how do we treat it successfully? I'm going to cruise through this a little bit because I want to get to the final part, but the most important part is education. It's something that's like so overlooked. We're so quick to call something a diagnosis and move forward with it, but we don't spend the time to empower people or educate people. So education. You can do all the treatment you want. You can get manipulated as much as you want. You can go see Dr. Charlie PT. You can do whatever you want. If you don't understand how to control the symptoms on your own, and you don't sort of have at least an idea of what could be going on and the contributing factors to it, the fire is going to keep stirring up, okay? So, if you want the best chance of getting better, you have to be educated on what's going on, all right? Consider this. You sit at the computer all day. Here's the equation you're up against. These are things that make me feel worse. Computer, looking down, computer, looking down. You got $1 million there. And these are the things that make you feel better. I do one neck stretch, or I look up, or something like that, right? I mean, the chances of healing in that environment are like really poor. And even the best injection in the world is like not going to flip that equation. All right. Awesome. Okay, so education. The next one is hands-on PT to reset We're not moving. Nothing's moving. The joint nerves. So what do? Why does hands-on therapy work? And why is it shown to be more effective than just exercise alone? And yeah, why is it shown to work? Well, what we know, and get this, if somebody cracks your back or they give you a massage, you feel good, right? The problem is something usually comes back thereafter. It has a transient effect. Here's what's actually happening. We did a study at USC where we looked at people with back pain, and we manipulated them. They were in acute pain. We looked at their brain MRI. We saw all the pain centers lit up in different colors. Very active brain because it was in pain, okay? What we did is we laid them on their side when they were in pain. Oh, by the way, we also measured their ability for their belly muscles and their hip muscles to fire. We hooked up little electrodes to them, okay? And what we did is we cracked their back. We cracked their back and they said, whoa, cool, wow, I feel good, all right? They had less pain. So we looked at the pain centers and they actually diminished. So manipulation or cracking or doing whatever, I don't care if it's acupuncture, it's your whoever rubbing your back, okay? It's the chiropractor, it's me, whatever, just touching you. The point is that hands-on techniques reduce pain centrally at the brain. They sort of block the pain signals temporarily, okay? The other thing that they do is they improve the ability for your muscles to fire. So if you treat somebody with neck pain and you crack their back, their shoulder blade muscles and their neck muscles will immediately improve, like with regards to their ability to function. We see on average about a 26% improvement in shoulder strength immediately after cracking someone's neck. All right. Now you feel good, and then you go home. And you're like, oh shoot, I got to go back because it didn't last, right? But you're not moving anything. You're not putting anything back in place. There's no knots. There's no nothing like that. It's input to the system. You're causing static to the system with hands-on techniques that just put static there and they sort of shock you out of it, all right? So it's like me going up to you, Karen, and just smacking my hand right in front of your face. You'd be like out of it for like 30 seconds a minute, all right? And then you'd be like, okay, here I am, right? Now, you have to reinforce this stuff or you get transient carryover and you go back forever. You have to reinforce it through, the final answer is like stability exercises. I don't really love that, but I'll just say that's fine for now. Stability exercises to reinforce, or I have here, change the way you move. So, we just said you move better because you have less pain and your muscles function better. Now, you're going to leave, you're going to go home, you're going to go sit at your computer. Well, hopefully they educated you on what could be leading up to that and gave you some tools and specific strategies for that. But then we need to reinforce it. Hey, look, so you don't need to see me a million times. What you're going to do is I'm going to teach you ways to move your own neck and back. So you know that technique I did where I turned your neck or I did this or I whatever, okay? You're going to use the same technique or try to mimic it as closely as possible by using a pillowcase. Make anything up, I don't care. One lady, she gets relief from taking an old bite tube that had a thorn poked in it, and she hooks it to the door, she lays down, puts it around her neck, all of her pinched nerve symptoms go away. She does traction, all right? Well, you could pay $50, $100 to go somewhere and have that done 3 times, or I can just give you a bite tube and you can control it whenever you want. Plus you get better super fast, all right? So the point is give people power through reinforcing it, all right? You can be creative through it, but this is usually some type of exercise that closely mimics the hands-on techniques that I provided that you can do on your own, okay? That's what makes it most effective. That's sort of like the glue that makes it stick, if you will. Awesome. Okay, final thing here. So, I already told you the answer to this, but this is the shocking truth about pain. I call it the shocking truth because the world's been fooled. It's not your fault, it's just what media does and everything else. We've been fooled to believe that we're broken. And as we get older, we have no control over the arthritis we're going to get, and we have a herniated disc, and therefore the only way to fix it is X, Y, and Z, right? We've also been fooled to believe that the only way we can tell what's going on is we need an image. Well, now we're learning that they're fairly useless. They're useless unless we think somebody has cancer or an infection or something big, ugly, and scary. Just to find arthritis, I mean, it's like I could have told you that. I can't tell you how many people say, well, my doctor told me not to come to PT first because we need an image. Well, I say you're not losing weight, you don't have any signs of cancer, you don't have any arm pain, numbness, or tingling. It's just in your neck and it hurts when you do that. And then it goes away. It hurts when you do that. It's mechanical. Your brakes are squeaking. I'm a mechanic. Well, he wants to make sure it's not a herniated disc. It could be, it could not be. And then people say, well, I had arthritis. And you know what? It started when I was like walking. And you know, I just like stepped off a curb and then like I went to the doctor and he said it was arthritis. Well, like, do you think your arthritis like just developed when you stepped down off the curb? Well, no, that doesn't make any sense. It was probably there for a long time, but it never caused you any problem. It doesn't even make any logical sense. That could have been your issue. So we can go on and on with it, but get that, yeah. 80% of people over the age of 50 have bulging disc and feel no pain. How is that possible? Where is pain created? Where is pain an output from? The brain, absolutely. Good job, Amy. So, time and pain. 400 nerves in the body, 45 miles of nerves just buzzing around waiting for you to turn your neck in a weird way, step off a curb, whatever, okay? Everybody has a pain threshold. It could be high, could be low, doesn't really matter, all right? Point is, let's just say, how many people in here have had a paper cut? Good. We're all human.
I didn't hear what it was.
Oh, okay. Let me see. A paper cut. We're good. So what happens when you get one? Does it feel good? What do you say?
Ouch.
Very good. Okay. So you say ouch. Now what happens after like, I don't know, 2 days?
It heals itself.
It heals. You live life and you don't, are you still thinking about the last paper cut you had? How many people can remember the last paper cut they had? Was it yesterday? Okay. You got me. All right. Okay, right. Point is, most of us forget about it. It's not that big of a deal, right? Pain is an experience. There's not much of an experience there. It's there. What do? You shake it out. You massage it. You crack it. Who cares? You put static into the system, distracts you temporarily, and then you go do whatever. Okay. Okay. So it goes back down. Now, let me ask you this. Would you think it was weird? How many people have had neck pain in here for 5 years? 10 years? 20 years? Wow. Okay, yeah. So, would it be weird if you had a paper cut that was still hurting you after 20 years? So, when I was 45, I was packing boxes, and it just didn't go away. Would that be weird? That would be weird, right? Weird is the good word, right? So, it just would never go away. So, let me ask you, that doesn't happen, right? That would be really strange, and we would question that. How many people go to the family physician for a paper cut? Nobody. That's, again, very weird, all right? So, point is that you hurt your neck. Maybe you're in a car accident, maybe, I don't know, you're sitting on your computer or whatever, okay? It creeps up on you, hurts like heck. Well then, what makes neck pain any different? It never goes away. How is it possible that a problem with the tissue, what's different about the tissue in your finger versus the tissue in your neck? What's different about a bone that you break in your leg or in your finger and it gets better within 12
Well,
weeks?
it was a more severe break than a paper cut.
Okay, a broken bone, but if you break a bone in your leg, it'll take 12 weeks to get better.
Yeah.
If you break a bone in your neck, it'll take 12 weeks to get better. It might leave you with stiffness. I get that, okay? But how is it possible that based off tissue healing, right, this stuff should get better? Does that make sense? How is it that you can have neck pain for that long?
You're not allowing it to.
I'm not treating it.
Right, so perfect. So you're not allowing it to heal. This could be part of the issue, right? You could actually have a problem within the tissue. Yeah, there could be some maybe arthritis, something like that, a bone or whatnot, that it's fully healed, but you're left with residual stiffness or something like that, okay? So it could be a problem in the tissue. If you had a paper cut 20 years ago, and then like every day for the past 20 days you looked at it and you scraped it and then you cut it back open again, would that be weird if you still had it? No, that would be dumb. Yeah, that would be stupid. Okay, that wouldn't be weird. That would just be stupid. But you wouldn't think it was so strange if you still had it because you knew that you kept sort of picking it, right? The same thing happens with neck problems. So it could actually be that you go in, you sit at the computer, you do the same stuff over and over again. You continue to sort of nick the scab, if you will. Absolutely, that could be a problem. Okay. But the other thing is, when you have a neck problem, do you go see the family physician? Some people do, some people don't. A lot of people do, okay? And they go to a primary care physician. By the way, primary care physician has no idea about anything with neck pain. Sorry, but that's not their specialty, right? If you have a fever, go see a family physician. If you have neck or back pain, don't go see a family physician. That's what we're trained to do, all right? They're the experts. So you go to a primary care physician, they say, well, your neck hurts. So take these muscle relaxants, or maybe here's an opioid, or you know what? Maybe we should just make sure this isn't anything serious, so then we're getting an x-ray. Then you get an x-ray. Comes back and says, wow, your neck, you meet with the orthopedic doc. You have the neck of a 90-year-old. You're like, well, I'm only 45. That can't be good, right? So then you're driving home, and your wife, husband, whoever is saying, hey, how'd your appointment go? You're saying, it was awesome. I have the neck of a 90-year-old. and I'm doing really well based upon his report, and here it is. Here's everything that's wrong with me, okay? So you have this death sentence, right? And you go home, you're feeling sort of down, right? When you're feeling down, then right when you get home, you say, Daddy, you know what? Let's go hit some balls outside and let's play catch. Oh man, I can't do that because my neck's killing me. So then you're feeling down. And then you can't sleep. Sleep is a bad thing, right? If you have neck pain sometimes, then you can't sleep. So then you release cortisol, which is a stress hormone. Then you're at work and you say, hey, I think my work's bothering me, to your supervisor. And the supervisor goes, you're fine. Get over it. Toughen up. You can handle it. Well, then you're pissed off, okay? So then you got this face, the teeth coming out, or whatever you do, all right? So the point is that there's this huge experience, right? Then it can cost you money, or you have to be out of work, whatever, okay? There's this huge experience that's created. It's much different than a paper cut. Those things heal, yes. A cut in the finger, a broken bone in the finger, a broken bone in the neck, all the tissue is essentially the same. It's really no different. It's either just that you're not allowing the tissue to heal, or that you create this chronic pain cycle, that this is your alarm system. I was doing pretty well, and then you know what? I just treated a guy. He's doing great. He was set on getting an MRI. That will tell me what's wrong. I said, okay, I know what it's going to tell you, and you didn't want to listen to me. That's fine, okay? I was doing great, Charlie. The day after the MRI, he calls and says, I'm in so much pain, I can't even bear it. I got a herniated disc, and the doctor says my neck is the worst he's seen, and whatever. Did anything change between yesterday and the day when he was in so much pain? The only thing that changed is he knew the results of his image. Results show that the people who know the results of their MRIs, in lower back pain at least, do much worse than the people who don't know it at all. Because it freaks them out, right? And then they're on this track, and you can't get it out of your head. It's like a train wreck. You just can't forget it, right? So the point is that it's like, oh, now I'm stressed out, socially can't do things, can't sleep, and you just start to get on this pain cycle where your nervous system is super sensitive. It's not correlated to the damage per se that you have, because everything's healed. 3 to 6 months, herniated disc will heal. 6 to 8 weeks, 12 weeks, herniated disc or bones that are broken will heal. But then you have pain that lasts forever. Could be that you have a tissue problem that you just keep nicking the scab with, or it could be literally that you just are dealing with a sensitive nervous system. Okay? Because you know too much, you've been to too many people who have told you 80 different things. The chiropractor says you're out of whack. The PT says your core is weak and your neck's whatever. Massage therapist says you have the tightest shoulders he or she has ever seen. If you go to a yoga therapist, you're not flexible enough, so you keep stretching. So on and so forth. And then you're like a pinball machine. You have no idea what's going on, all right? Because you're not getting accurate information. Awesome. Okay, so that's all I have. So I want to open it up for questions. Basically, I say pain is like the wind. You can feel it, but you cannot see it. There was a time I went in with an orthopedic surgeon. Charlie, this person's going to have terrible pain in this case it was back, in their right leg. The herniated disc is pushing on that nerve. Went in, hey, Mr. So-and-so, tell me about your right leg pain. I don't have it on my right leg, it's on my left leg. No correlation between the images, okay? Any questions before I sort of wrap up? Go ahead, Mark.
So, kind of keying off of what you just said, you go to all these different people, the yoga therapy, the massage therapist says this, the yoga instructor says that.
Sure.
So who do you believe?
Yeah, you don't believe any of them.
Right. Besides you, right?
You believe somebody who's going to listen to you and knows the evidence.
Right.
The problem is it's hard to find somebody that's not out to market you specific things.
Mm-hmm.
That sounded like my daughter's toy.
Yes, it is.
No, you must have.
It's her cell phone, okay. Sounds like the little thing. Yeah, so it's very hard to find somebody. We're all marketing, hey, like, if you go to PT, like, do this because your core is going to be whatever, and that's the reason you have back pain. I just saw on Facebook, it's like, oh, your bones are out of place, and that's why you have allergies, so we treat allergies, and we're chiropractors. That's baloney. I don't care if they're watching me right now, and this is live, okay? Because they have no evidence to say it actually works, all right? Now, you have a strong placebo effect, that if you have an ear infection, sure, your kid's ear infection is going to get better in 3 to 6 weeks. I went to the chiropractor, and they cracked my back, and it got better in 3 to 6 weeks. Yeah, it naturally would have anyway. Okay, so people don't know how to decipher through the evidence because they're almost, in a sense, sort of brainwashed a little bit, all right? Understand that if the only tool that you have is a hammer, everything's going to be a nail, right? So if you want to go to the surgeon, understand that they're going to probably, in most cases, don't get me wrong, there are some good surgeons, good PTs. I'm not saying that it's all bad. It's just you have to have somebody that doesn't say, this is what's wrong, this is what's, look, here are your options, here's what I think could be going on, here's why to support it, right? And here are ways that I think we could address it. And you know what, I tell people, maybe, I don't know, I don't really care about the whole ego thing, it's just like, look, I don't exactly know what's going on. Here's what we think is happening, here's what we're gonna do, and we have to be systematic in the treatment. That's the other problem with healthcare, is that you go somewhere, you go to PT, me and my own breed I'm talking about here, okay? It's like, we're gonna give you these 10 different things, and you're gonna do them over there in the corner. Well, how do you know if this thing canceled out that thing, which then, this was a strengthening exercise, but then you had me stretch it, so was I stretching it because it was stiff, or was I strengthening? They have no idea what they're doing. It's like a shotgun approach, okay? So, it's like, hey, look, could we systematically go through, right, and say, here's what I think is going on, we're gonna do these 1 or 2 things, and we're gonna test it out. We're gonna educate you about things that you're telling me are making it worse. I'm not telling you, I just had a lady the other day, hey Charlie, like my knee, I had knee pain or whatever, I went to the doctor, he said, never to run again. I treat a lady with neck pain right now. The doctor told me never to lift anything over my head again. Well, that's sad. How are you going to get the dishes out? And I said, does it hurt when you lift anything overhead? No, it doesn't at all. They took a cookie cutter kind of snapshot of, oh, neck pain, you shouldn't be lifting anything, and they applied it to that person. They didn't listen to what the person was telling them. So the point is that now I'm working with her, and I have to reverse all that negative vibe. So then she comes to me, and she won't even, for me, even try to lift anything overhead, because she was told by somebody who's smarter than I am, apparently, that she should never lift anything overhead. Right? So then you start to, a guy with back pain, hey, Charlie, I can't, like PT told me my disc was bulging out the back, and anytime I bend forward, it's going to pop out the back, or my chiropractor told me my hip was out of alignment. Therefore, you know what? I never, in 2 years, he's 32 years old, I've never tried to tie my toes or bend over. He walks into my clinic like this. Language, super powerful. So here's what I say, okay, here's what we're going to do, okay? We might not exactly know the tissue source. It was probably a disc. Okay, at the end of the day, who cares? Let's get you back to life. What do you need to do? I want to get back to jiu-jitsu. Pretty high-level athlete. Okay, here's what we're going to do. Stand right here right now. You got pain? Well, it hurts when I do this, but the PT told me only to do this because it's a disc. They're treating off the model of this is what it is versus listening to the person. I said, just relax, man. Just slouch for a little bit. Oh my God, 2 days later, I'm feeling great. Okay, now what we're going to do is I'm just going to have you lay on your back and bring your knees up to your chest. He's still rounding his back. He's just not, no gravity is against him, right? And he's rounding it from below. So his brain's like, wow, that's kind of strange. I kind of know that I'm doing that, but at the same time, it doesn't hurt. Right, so now he's desensitizing the system of movement. His alarm system's quiet. You're fanning the smoke detector, all right? And then as he goes, eventually, he's looking in a mirror, bending forward, touching his toes, things like that. So that's a good question, and that's a major driver behind why I do what I do, because you can't find much of the truth. Now here's the thing, we don't know everything, and I'm just as quick to say that, but we know a lot, and a lot of it is sort of tiptoed around and or used for marketing purposes to get people in the door, right? And it's a good scare tactic to tell people that they have X, Y, and Z and that they need to rely on whoever to fix it. But most people can actually fix themselves and or manage the problem themselves. They just don't have the tools, knowledge, and understanding to do it. So I don't know if that answers your question. It's long-winded, but you really have to systematically evaluate, and you have to question and call these people out. If you have a BS detector and it's going off, then you're probably getting it, right? So it's like, somebody went and said, I have to get a back surgery. I said, well, did you ask the surgeon? What's the probability it's actually going to change your symptoms? I can't ask him that. Why not? He's going on your back. So she asked him, oh, about 50%? Okay, well, that makes it a lot different. You said you didn't know what to do, but if you would have just asked him a few questions and challenged, Charlie, why is this working? Why are you doing this? You have the right to ask me. I would hope I'd have a good answer for you. And if I don't know, I'm just going to say, look, I'm doing this because X, Y, and Z has already been done, okay? And here's why we're doing it, here's the evidence we have, and here's kind of what led us here. So we're going to give it a try. Are you down for that? We're not going to hurt it, right? So let's go ahead, let's go down a path, but we're going to be systematic about it. So that's what I'd say, is that you need to try to weed through that. The issue is a lot of it's driven by productivity and the money versus actually the treatment provided to the patient. So until that changes, it's going to be a little tough to find somebody who's super upfront and honest. Yeah, that's unfortunate, but Good.
So, Charlie, you're saying for most of these people,
Yep.
like Mark and John, for most of us, our pain can improve by correcting how we do things, how we move, how we sit, the mechanics of our lives.
Yep.
But is there not an element for some of us that there's been damage done that just correcting the mechanics won't fix?
Yep, so, yeah, good question. So what I would say is, yeah, the majority of people can sort of get themselves out of trouble by doing less of what hurts and more of what makes them feel better, and or learning different ways to do those things, all right? So you might have to do computer work, but can you modify specific things within it? You know, I'm not saying don't do computer work, but are there different ways you can do it? Absolutely, okay? Sure, there are people that I see that are quote-unquote too far gone. There's a lady who came to see me yesterday, trying to move her hip. I mean, I can try, but to be honest, that's a hip replacement. Gets a hip replacement, now she has no pain, she can do whatever she wants. Maybe temporarily, what was the root cause? Who knows? But at that point, yeah, things were too far gone. So I think there are in some cases. I'm not here to say that we can fix everybody, not even close, okay? But a lot of people, when people say, I have one guy, what are your outcomes? Well, it's like, that's hard to define, because if you're defining an outcome as like 100% pain relief, well, yeah, it happens for a lot of people, but take into consideration that some of these people have had neck pain for 10, 20, 30 years. Mark, your outcome might be like, hey, would it be good to get 50% relief for your neck problem? Surgery probably couldn't offer you any better outcome. Maybe it could, okay? But would that be worthwhile for you? Some people say no. I don't want that. I wish I could say maybe 100%, right? But you got to take everything into effect, right? Because some people have other things. Diabetes, thyroid stuff, other environmental things that just don't allow them to put themselves in a very an environment conducive to healing. Okay, so I think there are some points where absolutely you might need some type of surgery, some type of whatever. Okay, because things are quote unquote too far gone. But yeah, a lot of people, the surgeries and the medications are just overutilized. Yeah.
On the other side of that, you know, talking about sort of somatic and psychosomatic pain and this pain cycle, high alarm. I mean, I'm thinking of Sarno's book. Are familiar with it?
Never heard of it, but
Richard Sarno. It's probably now 30 years old, but it was a big bestseller about how most back pain, like you're saying, is symptomatic, especially when we see it empirically, and then boom, the mind. And that you can also turn it off using the mind. So in any injury or pain cycle, how much of it would you say is the mind? And that balance of, you know, how much can help by calming down, like you said, and not thinking, oh my God, I need surgery, and here's why, look at my disc.
So I would say, right, so I start to get tipped off to those types of things when people start to say, hey, the more stressed out I am, the more my neck hurts. Okay, well that doesn't change anything on your x-ray, right? So, or hey, I see some people have terrible back pain and I just got divorced. Well, that's a little fishy, and you didn't have it before, right? So the point is that when things last beyond normal tissue healing times, you give yourself a nasty paper cut, it might take a week or two. You give yourself a herniated disc, we have evidence that these things can heal. Like legit, you look at the image and it's reabsorbed. The thing is gone. It doesn't just hang out there for ages, all right? So it heals, right? And then these people still say after 3 to 6 months, it still hurts. Well, that doesn't make any logical sense if you just look at the healing of it, okay? So what continues to irritate it? Then you have to ask, hey, is there something mechanically that this person's doing, they just keep irritating it? That could be definitely a case, okay? And or if it doesn't make sense and you change those factors, what we know is that people in chronic pain actually have, it's a very real thing, people aren't making this up. It is created and an output from the brain, okay? But you actually see brain changes. You will literally see changes within the brain and the way that things are processed within the brain, and people have chronic pain because they're walking around with a lion behind them all the time. Something that's been there all the time. You're walking into the room and you have the same tune playing 24/7. They don't even know what it's like to be out of pain. Because you don't hear that music for one day and you're like, turn the music back on. What's going on? Their body's almost trained to be in pain, okay? So it's how can we, what percentage of it? Hard to say, but in chronic pain cases, I mean, everybody has some component of it, okay? Now, some people will have more. Some people will be very much, you know, I have the guy with the heel pain or whatever, and he's very mechanical. It's on off, even though it's chronic pain. He can change it like that. He has no fear surrounding it, okay? There's something that we look for in healthcare. It's called DIMS, dangers in me. Somebody comes to me and they say, you know, Charlie, like I was doing really well, then I had this image and, you know, the PT told me it was squirting out the back and it was hitting my nerves, and then the chiropractor told me I was out of a line. You know, my kids can't play with me. I'm just like really upset about it. It's changed my whole life. Those people have that. They have a lot of fear and a lot of really like impact around their condition, right? Versus somebody who just says, dude, it just hurts when I do this. Can you just fix it?
Right.
I don't care if I have a stenosis or whatever they said. It just hurts. Can you just make it go away? That person is likely less into that psychosomatic, whatever, pain state, okay, chronic pain state, versus the person where you can kind of sense that snowball effect of story coming to the surface, right? And you just manage them a little differently. And these people aren't crazy by any means. It's a real thing that actually happens. We see true brain changes.
Oh, yeah.
The cool thing is that it's reversible.
And
Exercise.
Something like fibromyalgia, where you're told, we don't know exactly, but you got this chronic pain. Do you think that's also
There's a component for
reversible?
sure.
It's tough.
Yeah, I think so, because I've taken people with fibromyalgia, and the most powerful opioid or painkiller we have is exercise. It releases endorphins.
But
Okay?
not too much.
Yeah, you give people a progressive. How do you change this? Most people do this. Screw this, Charlie. You know what? My neck hurts. I'm just going back to jujitsu, or I'm going back to work, or whatever, okay? Bam. Your body's gonna say, what the heck are you doing? Okay, you can't do that. Oh, and then I'm in pain for 4 days, okay? Bam, I'm in pain for, no. Here's what you're gonna do. You're gonna walk in the gym and watch someone wrestle. You're like, what, that's it? Yeah, that's it. You're gonna walk in the gym and watch someone wrestle. I had a lady that only had neck pain when she would drive past a certain house on the street because that's where she got in an accident. You can't treat that mechanically. She had 1,000 MRIs. They're like, nothing's wrong with you. Yeah, because it's not a problem there, okay? The problem is that, here's what we do. We treated her as I was doing techniques on her neck to reduce sort of the sensitivity of the system. We know it does that. We talked about how it kind of gives you static to the system. She watched videos of, what do you call that when somebody hits your bumper? Fender bender. Sorry, I can't think of it. Of fender benders. And then she watched somebody get hit by a bike on the thing while I'm doing this. Then she watched somebody get in more of a car crash. Pain gone, okay? Amazing, right? So I didn't do anything mechanically other than use what I know that will decrease the sensitivity of the system, right? But the point is it's got to be progressive. It's got to be progressive. That guy who can't bend over and touch his toes, I just can't say, screw it, all those PTs are wrong. Touch your toes, there's nothing wrong with you. No. It's a very real thing. He's convinced himself and his brain has actually changed. He's in chronic pain. No worries, he's not crazy. It's very normal, okay? So you know what you're going to do? Just knees to chest. Just do 10. Does it hurt? No, you're done for the day. Walk away. How do you get used to heights? Okay, you're done. That's it. How do you do it again? Okay, you're done. That's what you're going to do. That's your treatment. Okay, you're going to walk up to, you're going to look over, and instead of being there for 5 seconds in 2 weeks, now you're going to be there for 5 minutes. All right, and eventually you're going to habituate to it. So it's progressive reintroduction to it without such that when you get to a point, it's like, oh, ding, ding, no. That wasn't that bad. Wow, I could do things. It didn't hurt that bad. Okay, ding, ding. Stop it there. Wow, that wasn't. And eventually, this thing starts to calm down. So rather than being stuck up here, where you have like no room to do activity before you have pain, you start to desensitize the whole system such that now you've got all this room to do these activities as you once had. Okay? Now, it is tough. A lot of these people, I'll say, I work with them for 3, 4, 5, 6 months sometimes, usually very infrequent by that point. But then it's something where, hey, Charlie, I'm 80% improved. Thanks so much for your help. And I told him, realistic, maybe you won't get full relief while we're together. Let me see you in a year. You keep going with what you're doing. Okay? I would lay with back pain, chronic back pain. She now Orange Theory queen, running marathons, things like that. Text me, doing great. Once I discharged her, she was 80% better. I kept in touch with her. Now a year later, no problem, doing wonderful, okay? So it takes time. That's the issue. It takes time for these things to sort of reverse themselves. So by no means is it a miracle pill to treat a lot of these chronic problems. It's a very upfront conversation. Like, look, it's been going on for a long time. You can't expect this is going to get better like tomorrow because it's just not. That's unrealistic. Instead, you're going to work at this for X, Y, and Z depending on the history, and here's what we can expect from it. And part of the treatment, if there is some signs of that, might be to address that through progressive graded return to exercise, return to activity, exposure to whatever that is that they're having trouble with in creative, unique ways. People with stroke, oh, I have pain so bad in my left hand I can't move it. Well, stand in front of a mirror and move your right arm. Wow, it looks like my left arm's moving. Keep doing that. It retrains the same, what we call mirror neurons. Mirror neuron here fires the same neuron over here that does that same action. Strength training, if you can't, people go get a rotator cuff surgery or whatever, they sit in that sling. Or they sit in a neck brace. Neck is kind of central, but we have evidence in the shoulder. If you're in a neck brace over here, you tore your ACL, work the heck out of the opposite side. You'll see 40% strength gains on the same side where you're not actually moving. Okay? Don't just sit there. Don't go to PT and like, oh, this is all we can do. The surgeon said protocol. Work the heck out of the other side. Do shoulder presses. See if you can work on some, like get it moving because you'll fire the same things. That's how we sort of re-coordinate the system. And that's evidence-based. We know that works in people who've had stroke. Okay? Helpful? Okay, so I'm going to hang around for questions. How many people got their money's worth? Cool. Okay, so I'm going to hang around for questions. All right, now, I usually don't offer this to the general public. Everyone that comes to my workshops, I'll tell you I do, okay? What I'd like to offer everyone, no tomatoes, nobody tests my reflexes, thank you. I'd like to offer a free 45-minute consult, all right? It's one-on-one, just me and you. We sit down, we listen to the story, we chat about what's going on, and we decide a plan, basically. Will it work, will it not work? And here's what it looks like, or here's what it doesn't look like if we're not a good fit, okay? How many people want to have less neck pain, move better, feel better, not hate their computer work? Say aye.
Aye.
Okay. So if you said aye, if you want to take advantage of that, my wife and baby Cameron, as well as myself, we have a phone. I have my schedule. I reserve some specific spots for people in my workshops for those consults.
So we
okay?
can have this 45-minute consultation at your place? Or?
Yep, it's in Royersford. Yep, and I can give you all the info. I have cards and things like that on the way out. Okay. So if you want to take advantage, you can do that. You can head over there. I'll be over there as well. And then I'll be here, I guess. Does this place close in 15 minutes?
Yes, it does.
You got 15 minutes to ask me anything you want. Okay?